Welcome to the Yupleri VR experience. Here you would learn about the mode of Yupleri among patients suffering from COPD, or Chronic Obstructive Pulmonary Disease. To understand this effect better, let us first look at the physiology of normal pulmonary, or lung, function and the pathological changes that occur in a patient suffering from COPD. Yupleri is administered with the help of standard jet nebulizer. Click here to view the assembly of a standard jet nebulizer.
Yupleri is a prescription medicine used to treat chronic obstructive pulmonary disease, COPD, a long-term chronic lung disease that includes chronic bronchitis, emphysema, or both. It is an anticholinergic medicine which helps the muscles around the airway in your lungs stay relaxed to prevent symptoms such as wheezing, cough, chest tightness, and shortness of breath. It is used long-term as one vial of Yupleri once every 24 hours, inhaled through your nebulizer to improve symptoms of COPD for better breathing. Do not use Yupleri if you have sudden breathing problems. Always have a rescue inhaler with you. Do not use Yupleri if you have had an allergic reaction to revefenacin or any other ingredients in Yupleri: sodium chloride, citric acid, sodium citrate. Do not use in children. It is not known if Yupleri is safe and effective in children. Stay tuned for additional important safety information in this video. Welcome to the Yupleri Instruction for Use video. It is important to learn how to correctly use Yupleri, an inhalation solution from Mylan and Theravance Biopharma. Yupleri is used long-term as one vial of Yupleri once every 24 hours, inhaled through your nebulizer to improve symptoms of COPD for better breathing. The recommended dose of Yupleri revefenacin inhalation solution is one 175 microgram unit dose vial administered once daily by nebulizer using a mouthpiece. The safety and efficacy of Yupleri have been established in clinical trials when administered using the PARI LC Sprint nebulizer with a mouthpiece and the PARI Trek S compressor. Before we discuss how to use Yupleri, let us quickly take a recap on the components of the nebulizer and how to assemble it. PARI LC Sprint reusable nebulizer comprises of an inspiratory valve cap, a nebulizer top, nebulizer outlet, mouthpiece with expiratory valve, nebulizer insert, nebulizer cup reservoir, and wingtip tubing. Before use, properly clean and/or disinfect your nebulizer. Reassemble the nebulizer when the parts are dry. Insert the nebulizer insert into the nebulizer cup and then assemble the nebulizer top over it. Next, attach the mouthpiece with expiratory valve firmly over the nebulizer outlet. Finally, insert the inspiratory valve cap over the nebulizer top. Your nebulizer is now ready to use. Now, let's get started. Make sure you know how to use your nebulizer machine before you use it to breathe in Yupleri or other medicines. Do not mix Yupleri with other medicines in your nebulizer. Yupleri comes in a vial that is sealed in a foil pouch. Do not open the sealed pouch until you are ready to use a dose of Yupleri. Use your Yupleri right away after opening. Follow these steps each time you take a dose of Yupleri. Step 1. Open the foil pouch by tearing along the seam of the pouch. Remove the vial of Yupleri from the foil pouch. Step 2. Carefully twist open the top of the vial and use it right away. Step 3. Squeeze all of the medicine from the vial into the nebulizer cup reservoir. Step 4. Connect the mouthpiece to the nebulizer cup reservoir with the expiratory valve facing up. Step 5. Firmly insert one end of the tubing to the compressor. Insert the other end of the tubing to the bottom of the nebulizer cup reservoir. Step 6. Sit in a comfortable upright position. Place the mouthpiece in your mouth and close your lips around the mouthpiece. Step 7. Turn on the compressor to begin your treatment. Step 8. Breathe as calmly, deeply, and evenly as possible until no more mist is seen in the nebulizer reservoir. Your treatment will take about 8 minutes. When you do not see any mist in the nebulizer, your treatment is finished. Turn the compressor off. Step 9. Clean and store your nebulizer. See the manufacturer's instructions that come with your nebulizer for how to clean and store your nebulizer. Now let's discuss how to store Yupleri. Store Yupleri at room temperature between 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius. Store Yupleri in the unopened protective foil pouch and only open the foil pouch right before you are ready to use Yupleri. Keep Yupleri away from light and heat. Throw away the vial of Yupleri and any leftover medicine after use. Throw away the vial of Yupleri if the solution is not clear and colorless. Do not use Yupleri after the expiration date provided on the foil pouch and vial. Keep Yupleri and all medicines out of the reach of children. Please continue to watch for important safety information about Yupleri. This summary does not include all the information about Yupleri and is not meant to take the place of a discussion with your healthcare provider about your treatment.
Let us go inside the lung of a patient suffering from COPD, understand the disease better and how Yupleri works. COPD or chronic obstructive pulmonary disease is a chronic inflammatory lung disease that causes obstructed airflow from the lungs. Symptoms include breathing difficulty, cough, excessive mucus production and wheezing. In healthy individuals, oxygenation of blood occurs at the level of alveoli, which are the smallest subdivisions of the airway. Air that is inhaled travels through the trachea, or windpipe, into bronchial tubes. Bronchial tubes divide into smaller units called bronchioles, which further divide into alveoli, or air sacs. The capillary network surrounding the alveoli provide them with a rich blood supply. Oxygen from the air we inhale crosses through the walls of the air sacs into the capillaries, leading to oxygenation of blood. Now for this oxygenation to be effective, the width of bronchial lumen and elasticity of the walls of the alveoli needs to be optimum. This is where muscarinic receptors. Click here to see how COPD affects the alveoli of the patient. Our lungs rely on the natural elasticity of the bronchial tubes and alveoli to force air out of our body. COPD causes them to lose their elasticity and overexpand, which leaves some air trapped inside when we exhale. Notice how the alveoli of the affected patient are changed due to the disease. Unlike healthy alveoli, they lose their elastic quality and make it difficult for regular breathing. We will now observe the mechanism of action for Yupleri. Yupleri is a muscarine antagonist that demonstrates long-acting anticholinergic effects by binding to muscarinic M3 receptors and preventing the uptake of acetylcholine. When administered through inhalation, Yulpheri has a site-specific action preventing acetylcholine-induced bronchoconstriction, a decrease in mucus secretion and reduced inflammation. Additionally, opening of bronchial tubes also restores the natural elasticity of alveoli. This combination of benefits provides considerable relief to patients suffering from the debilitating effects of COPD.